Hello ladies, I have quite a few updates, and so please bear with me as I get through my long list of updates here. First things first is Joint Commission has yet to show up, and so that means we get to continue to be really prepared and Joint Commission ready. A couple of things we've been noticing over the last few weeks. People really love storing things in biohazard bags. That's a big no-no. So please, if it's not a lab, if it's not biohazardous, don't put it in one of those bags. We have Ziploc bags stored in the clean supply. We also have the small ones in the med room by the return bin. So if you need a Ziploc bag that's clear, please go get one from one of those places. The second thing for Joint Commission readiness I want to make a big stink about is not using patient stickers on our screens. Don't put a patient sticker on the screens to scan for your labs or your meds. Please scan their wristband. We've been finding sticker residue on a lot of our monitors, and this will also be a major finding. And also, it's not best practice. So do the safe thing, do the right thing for your patient, scan their label, or scan their wristband, then scan the med or the lab, and just let the system do the work for you and keep you and your patient safe. TCB results we fixed Epic. So instead of charting them under the billimeter reading, you can now just document under the transcutaneous bilirubin in the flow sheet, and it will flow over to the chart that the pediatricians look at. Yay. As we roll out this new QR code process for our birth certificates, we've had a couple of patient questions about future due dates, or about past due dates, I guess. So if they are over their due date and it's asking for their due date, it won't allow them to put in a date in the past. And so if this is the case for your patient, just tell them to leave it blank and it will still allow them to submit the form. As we continue to be busy, we have decided to implement a resource nurse on each shift, and what this nurse will be responsible for, first main responsibility will be our triages, or our OBED. And they'll be the main nurse to help with these patients, to help with NSTs during the day, and then also will be backing up our transition nurses. And so if you are a labor nurse who is interested in filling this role, will you please message me individually and I'll add you to my list. And if you feel like you need some orientation for transition, let me know. We'll have to probably do that outside of your regularly scheduled shifts just because of how busy it's been. But again, you won't be responsible for the whole transition. You'll just be backing up our transition nurse. So you'll usually be just grabbing a set of vitals, maybe giving some meds. There will be the occasion where we have a couple deliveries happening at the same time. And so you could be at the bedside actually catching the baby too. So if there are things that you're not quite comfortable with, but you still want to fill this role, let me know. We'll get you up to speed. And I think this will be really helpful. This resource nurse will be able to fill a lot of gaps and hopefully take some pressure off of our second floor charge nurses. Everyone that has picked up incentive shifts, I thank you so much. I want to reiterate that we cannot pay callback pay on top of this incentive pay. So if you're picking up an incentive shift, it's the flat $15 an hour. And then if you have a call shift, it's just the time and a half. So we can't double up on those. I wish we could, but we can't. And so if you have picked up an incentive shift, what I've told the charge nurses is it's kind of a use them or lose them, so that as you're picking up all of these incentive shifts, you're not required to stay on call if they don't need you first thing. But if you want to stay on call, you're more than welcome to. I think that's all I had about incentive shifts, but if you guys have questions, please feel free to reach out to me. There is a new process for ordering emergent blood. This is a good segue, I guess, first step before activating an MTP if the provider is not really sure if you're going to need to go down that route. There are some instructions in the charge nurse binder or in the emergency resources binder on how to order this emergent blood, and then I'll also post it in the GroupMe so that you guys can see that. And I think it's just 2 units of packed red blood cells, and then anything beyond that, you know, if you're still needing product really quickly, that's when you'll implement the MTP. We are getting our own Belmont rapid infuser. For all of those who've attended Skills Day, you have seen it. For all of those who are at our last charge meeting, you have seen it. It's amazing. It's super intuitive. I love it. And I'm really excited that we're getting one. So right now there's only one for the whole hospital, and it's located downstairs next to the malignant hyperthermia cart in the OR. So if you need it, that's where it is. If it's during the day, you can have the OR bring it up. If it's during the night, you can call House Soup and have them bring it up, or send someone down to grab it if they know, well, everyone should know, hopefully, where the malignant hyperthermia cart is downstairs. For the health stream about the Belmont, there are 2 sections that you do on HealthStream, and then the third one is a checklist. So once you've been able to see the Belmont at Skills Day, or you were at the staff meeting and you need that checked off, you can submit for me to check that off as your evaluator. Okay, and then the next thing is language services. I guess some of the hospitals that have already gone through their Joint Commission survey this year have found that there is a gap where people have been not documenting their language services or their interpreter. So on Epic, there's a flow sheet called Interpreter Follow-Up that you'll document every time you are using the interpreter. I will print out the huddle topic and I'll put it in our education binders so that you guys can look at those when you have a sec, and I can stick them on the break room boards as well. Another finding is when people are using large gauge needles or blunt tip needles to draw something from a vial, they're having a lot of vial coring, and so a piece of that rubber stopper is getting pulled into the needle and then pulled into the medication, and it's a safety risk for our patients. And so what they are asking us to do at this point is use a smaller gauge needle. They said 20 gauge or smaller, and insert at a 45-degree angle rather than a 90-degree angle, as this will lessen the risk for coring in our vials. The other option is just using a filter needle. We have the blunt tip needles that are not filter needles, and then we have them that are. So if you're using the ones that are not, I would caution you to please not use them. But if you are, to be really diligent in looking for any of the sediment that could be coming from that. Our TXA vials are changing or have changed. I need to go look and see. The top of them used to be big enough to fit into our 100 ml bags that we use for like ampicillin. It's a smaller top now, and so you'll have to just grab a 100 ml bag, and then the adapters, the what are they called? The vial to bag adapters. We have the blue ones stocked that we use regularly for like azithromycin. They're gonna start stocking orange ones that fit the new top to the TXA. So remember, TXA 100 ml bag, and then the orange vial to bag adapter. And we'll store those in our hemorrhage carts as well. Rapid response handouts are gonna be added to all of our patient folders. So feel free to educate to this on admission. It's just empowering family members to call a rapid if certain criteria are met. I don't think that it will be used a lot on our floor, but it's something that is important to our division leaders. So, last thing, I hope, wow, this is a long one. A lot of you are coming due on your N95 fit test soon. And so if you need a fit test, if you can find Melissa or Cami on your shift, they are your go-to gals. But any of your CNCs or myself or Deborah are happy to also help you with your fit tests. And with that, I hope that's all. Thank you for everyone who has pitched in extra these last couple weeks. I know it's been busy. I know it's going to be busier, and I am just really grateful for all of you and for the amazing team that we are and the amazing work that we do. Okay, that's it. Goodbye.